Hello, my name is Amira with the Village of Hoffman Estates Health and Human Services. February 21st through 26th marks National Eating Disorders Awareness Week. According to the National Eating Disorders Association, eating disorders are a serious yet treatable mental and physical illness. And when we think about eating disorders, a lot of the times we may be thinking about the narrative that we constantly see shown in pop culture, maybe some movies. The individual who wants to lose weight and may develop an eating disorder in the process, or dancers or models who are told or pressured by individuals in their industry to remain a specific body shape and size in order to succeed in their craft and in their field. But the fact of the matter is, eating disorders can affect us all, regardless of age, gender, weight, body shape, size, sexual orientation, socioeconomic status. We are all susceptible to eating disorders. National surveys have found that approximately 20 million women and 10 million men in the United States will develop an eating disorder at some point in their lives. Trans individuals have been found to have higher rates of eating disorders than their cisgendered peers. And while there are many reasons why this might be true, 32% of trans individuals diagnosed with an eating disorder have stated it's because they were trying to alter their body as an alternative to hormones because they did not have adequate access to hormones. So like I said, it impacts all of us. And while we don't know the specific causes of eating disorders, we do know that it's due to a wide range of biological, psychological, and sociocultural factors. And one cultural factor that I kind of want to take a stab at today is diet culture. Now, before I get into what diet culture is and more about how it can influence eating disorders, I want to talk a little bit about what disordered eating versus an eating disorder is. An eating disorder, like I said, is a mental and physical illness. So in order to meet criteria for an eating disorder, you must be diagnosed by a professional in the medical or in the mental health field. Disordered eating are symptoms of eating disorders, but does not necessarily equate a full-blown eating disorder diagnosis. For example, I could skip 2 meals a day. I could skip breakfast and lunch out of convenience and go about my life, but it's not impacting my functioning. So while my skipping meals may be a disordered eating habit, it doesn't mean that I meet criteria for an eating disorder because I skip meals. So while not everybody has an eating disorder, a lot of us do have disordered eating habits, myself included. So diet culture, is this lovely message that there's a one-size-fits-all approach to health. On average, Americans spend approximately $60 billion a year on diet, weight loss plans, diet products. And it's with this idea that there is this one-size-fits-all approach to our health. And that is usually based on European beauty standards, European health standards. And that equates thinness to health. So if you are thin, you're considered to be healthy. And if you're not, you need to change and become a thin person because you are an unhealthy individual, which unfortunately is not the case and is not an achievable goal for every single individual. Not all of us are meant to be thin. That does not mean that we're unhealthy and programmed to be unhealthy. But when we are fed this narrative that we need to be a specific size in order to be healthy and functioning and happy and successful, we start doing everything we can in order to achieve that goal. We want to cut out the carbs. We want to utilize intermittent fasting. We may want to we want to count the number of calories that we're consuming on a day-to-day basis. All of which can lead to disordered eating habits. And unfortunately, the diet industry has normalized multiple disordered eating habits, such as restricting food, fasting. And I say this, fasting with the intent of losing weight, not fasting with the intent of practicing Lent, observing Passover, Ramadan, or any other religious or cultural tradition. But Unfortunately, the diet industry does perpetuate a lot of disordered eating patterns within us, and it has normalized it to the point where we don't even know what's healthy and what's not for our bodies anymore. And this isn't to in any way shame anyone for partaking in a weight loss program or trying to lose weight, wanting to lose weight, or wanting to diet. I've dieted myself. I've tried to lose weight myself as well. And it's a human thing. We all want to do it, especially when we're taught this narrative our whole lives. What I want to do today when it comes to diet culture is examine some of the toxic messaging that this culture perpetuates that it can influence disordered eating and the risk someone developing an eating disorder. So you try to fit this mold. So you try keto, you try paleo, you try Jenny Craig or Weight Watchers, and it can work, and you lose the weight, and you feel wonderful. Unfortunately, it's not always sustainable. Studies have found that 95% of the time, when individuals have lost weight, they end up gaining it back within 1 to 5 years. And this isn't to say that the individuals who have gained that weight are somehow wrong, or that there's something inherently wrong with them, or they didn't try hard enough. This isn't to shame those individuals. This is also an issue with diet culture. Diet culture will shame individuals when the weight loss is not sustainable or when the diet doesn't work. Instead of putting the onus on the program for not being sustainable and effective, it will put the responsibility on the person to try harder to achieve that ideal weight that their body may not want to stay at. It may not be natural for their body to stay at that size. And so what happens is when individuals fail, they start to shame themselves. Individuals who don't fit this ideal mold start to get stigmatized. And it ends up reducing and really negatively impacting our body image as a society, whether diets work for you or not. And now body image is how a person relates to their body, their physical appearance, and their shape. It also relates to how a person physically feels in the body that they have. And studies have found that negative body image increases the risk of a person developing an eating disorder, depression, anxiety, low self-esteem, and even isolation. So we have perpetuated the society that's constantly obsessed with weight. Our self-worth, our body image has been attached to this number on a scale. And while weight is important, it's only a piece of the puzzle. It's not the full picture when it comes to your health. You can be very thin and fit the ideal body type that society has perpetuated as healthy and not necessarily be a healthy individual. Likewise, you can also be a person who is in a larger body, a body that society may not deem to be the healthy body, and not necessarily be unhealthy. You could be very healthy and very, very comfortable with your body and where it's at. And that's wonderful. But unfortunately what happens is that the diet industry, this multi-billion-dollar industry, has bombarded us with ads of before and after images, how to trim the fat off your stomach, how to achieve the thigh gap, and unfortunately, as a result of this, we are constantly comparing our bodies to other people. We are putting ourselves in a position where we're shaming individuals who don't fit the mold, and it does lead to fat phobia. And fat phobia is not just pointing at someone and saying, oh, they're fat, they're disgusting. It's not just saying, oh, this person in a large body must be lazy. That's a part of fat phobia. But another portion of it is a portion that we have all somehow internalized, where our sense of self-worth decreases every time that number on the scale goes up by a pound or 2. Every time that number goes up, our self-worth goes down. We start to get really upset at ourselves for gaining weight. And so what happens if you are in a larger body? And what has fat phobia done to our society? Well, individuals' negative body image, as I've mentioned earlier, have a higher risk of developing eating disorders. And individuals who do fall outside of that ideal body weight realm or ideal body type that's been deemed healthy are stigmatized. And they're more likely to try and take on these, habits and find diets and weight loss programs to lose weight. However, individuals in larger bodies are half as likely to be diagnosed with an eating disorder as their peers who are labeled underweight or normal weight. Much of the time, this is because doctors don't assume they have an eating disorder and they don't ask about it. And I don't know if anyone can relate to this, but many a time when people in larger bodies go to the doctor and express that they have X number of symptoms and they're struggling in one aspect of their physical health, the answer ends up being, if you lose weight, this problem will be solved, perpetuating, this systemic issue within the medical field that unfortunately leads to a lot of people falling through the cracks and not being taken seriously by their healthcare providers. And we're still equating weight to the main equation for health. While weight is a portion or a piece of the puzzle, it's not the full picture. Health is, being able to eat when you're hungry and stop when you're full. It's being able to feel energized and able to focus on your day-to-day tasks. It's being able to complete your day-to-day tasks because you have the energy to do so. It's your sleep hygiene. Are you sleeping well? Are you able to get an adequate amount of sleep every night? Or are you restless? Are you having trouble staying asleep? And we can achieve those facets of health regardless of what size we're at. The new wave of addressing this negative image in our society, in terms of weight and in terms of health, is this philosophy called health at every size. It's starting to make its way through the medical field and through the mental health industry. And so essentially teaching ourselves about compassion to our bodies, accepting our bodies for where it's at, and loving ourselves allows people license to take better care of themselves in terms of eating in a way that pleases their bodies, exercising and doing exercises that they enjoy rather than exercises that they feel they have to do. And this isn't to say that anybody who tries to lose weight or anybody who tries to diet doesn't like their body or doesn't care about themselves. Absolutely not. It's more or less saying that there's more to your health than your weight. And the first step to taking care of your health is loving yourself and loving your body for what it can do, and allowing yourself license to not have to fit that mold, that you have to be thin in order to be healthy, or you have to be the specific type of thin in order to be healthy, because we also know that there are individuals who are told they are too thin to be considered healthy, and they end up being shamed, and they end up being stigmatized for not fitting that specific mold either. In fact, less than 6% of individuals who are diagnosed with an eating disorder meet the criteria for being underweight. So this unfortunately leaves individuals at both ends of the spectrum, whether they appear to be quote unquote underweight or appear to be in a larger body, doesn't necessarily equate them having an eating disorder. However, they fall through the cracks and they are somehow stigmatized by society for not fitting into the mold. And so what is the alternative to diet culture? Well, the new wave currently being used to treat eating disorders while also being used to prevent them is intuitive eating, a new wave of treatment that we're starting to see in the mental health and in the medical field. Now, intuitive eating is this anti-diet, weight neutral approach to your relationship with food. Now, when I first heard of this, I was very skeptical. And I started to wonder, how is it that we're told throughout our whole lives that if you eat a specific amount of carbs a day, specific amount of calories, you can gain more weight. And if you gain more weight, you'll end up, if I gain more weight, and if I gain more weight, I'm somehow going to develop diabetes and blood pressure and all of these other medical concerns. And what do you mean I can be weight neutral and not diet whatsoever? So I was very skeptical when I first read about this. However, when looking into it further, the research suggests that individuals who have tried intuitive eating versus a restrictive form of eating, which is more, or eating with restraint, which is more along the lines of what a diet is, eating with restraint, have found that individuals who utilize intuitive eating have been associated with having lower BMIs as well as decreased disordered eating patterns. And individuals who engage in restraint in their eating have been found to have increased rates of BMI as well as increased rates of disordered eating patterns. So the research has also shown us that intuitive eating is a lot more sustainable and has more long-term effects than simply dieting. Like I said, 95% of the time, individuals will regain that weight that they lost on the diet within 1 to 5 years. Intuitive eating teaches you to be attuned to your body and thinking about how your body feels and what food it needs in those moments and honoring your body's needs. So a lot more long-term and a lifelong skill. We were all born intuitive eaters. However, throughout our lives, we have been fed this narrative that we have to start watching what we eat as we get older. We start wondering, should I eat the egg yolk? Should I not eat the egg yolk? Can I eat the whites? Can I not eat the egg whites? We start wondering, can I have milk? Can I not have milk? Is it healthy to eat dairy? Is it healthy to eat gluten? We get into our heads and we start questioning all of these foods and we start restricting certain foods that our bodies need. We've demonized carbohydrates. Our brains need food. Our brains need carbs in order to function. So let's think a little bit about what intuitive eating is. Let's look at what normal eating is. We've talked a lot about the dieting and the disordered eating. Let's look at the other side of the other end of the spectrum. Let's explore this a little bit more.